Hello. Today, I would like to invite you to think about mental illness as another manifestation of a chronic medical condition, that there really is no separation between the two. This idea has become more and more popular and controversial to a certain extent in the clinical psychology community, in the health psychology community especially, as practitioners and researchers are seeing increasingly that the mind and body are not, in fact, two separate entities that have nothing to do with one another. They are, in fact, very much interrelated, interconnected, and interdependent, relying on one or the other to produce human functioning in the world in which we live. So, as I've learned more and more about chronic medical conditions, chronic medical illnesses, so things like diabetes, heart disease, cancer, autoimmune disorders, these conditions that individuals have for a long period of time, it has come to my attention that many of our psychological disorders, our mental illnesses, are also chronic conditions. So people diagnosed with schizophrenia have this diagnosis for life, essentially. The same goes with depression and anxiety. We see individuals come in for treatment and stay in treatment for years and years and years. We see individuals prescribed medication, so antidepressants, antipsychotics, anxiolytics, various pharmaceuticals, and they stay on these medications for years and years and years in order to manage the symptoms. So things like anxiety and panic attacks and depressed mood, reduced appetite, erratic sleep, high stress levels, all of these various symptoms of mental illness. So in a very similar way, the Western biomedical healthcare system is managing the symptoms of chronic illnesses, such as, again, diabetes, heart disease, cancer, these various autoimmune disorders, chronic pain, with medications in many instances, surgeries, and things like that, treating the symptoms of an underlying disorder. So, thinking about mental illnesses as kind of things in themselves, right? So we've explored the idea that they are hypothetical constructs that do not actually exist. So entertaining the idea that these are actual things that last over a lifetime, conceptualizing it that way, because that's a lot easier for mind to think about, we can see that psychologists and psychiatrists are doing much the same thing with chronic mental illnesses as doctors and physicians are doing with chronic medical conditions. So they are treating symptoms, managing the disorder or managing the disease, rather than actually addressing the underlying cause. So as I've talked about before, psychology is seeking to mimic and model itself after biomedical science over the healthcare system, because the two are completely interrelated, seeking validation as a scientific discipline that is based on hard evidence and science as much as these physical disorders, these medical conditions that we are seeing. And as a result, it is also creating and propagating this reductionistic paradigm wherein an individual is reduced into component parts rather than conceptualized and treated as a whole integrated living system of mind, body, and spirit as well. So a higher consciousness beyond that which is contained in mind and within body. So as a result, we're not seeing people get better. We're not seeing individuals get off their medications for diabetes or depression. We're seeing people use these medications, these treatments, needing to go in and see the doctor again and again for maintenance, for symptom management, on a weekly, bi-weekly, monthly, whatever basis for a physical condition. In the same way, we're also seeing individuals, participating in psychotherapy for years and years and years. It may be some individuals who are not participating in psychotherapy. They're participating in support groups, group therapy, or they're taking pharmaceuticals prescribed by a psychiatrist or some kind of physician for years and years and years. And at the same time, we are seeing an explosion, a literal explosion of chronic medical conditions. So again, these diabetes, heart disease, cancer, things like this. We're also seeing an explosion of these depressive and anxiety disorders and all mental illness as a whole. And the argument, is kind of a back and forth. Are we seeing them because, we're researching the diagnoses more and more often? Or are we actually seeing an explosion of things like ADHD and autism in children, as well as depression? Because, millions of Americans are taking antidepressants, and they're taking them for extended periods of time. And I've heard very compelling figures of, half of Americans or something like that will be diabetic by the year, in 15 years or something similar like that. So again, there's really an explosion of these chronic conditions, both mental and physical, psychological and physical. And again, there is really no separation here. And what I would like you to think about is, that there is no separation. And that, of course, if we're going to seek to treat chronic mental illnesses in the same way that we're treating chronic medical conditions, of course people aren't going to get better. Of course people are going to be more and more reliant on a system that is unable to address the cause of a problem. And I would like to invite people who have either a chronic medical condition or a chronic mental illness to really reflect upon their lifestyle. And this is something that's not readily talked about in medical and psychological communities alike, because it's not reimbursed. You don't get paid as a practitioner to talk about lifestyle interventions. As a medical doctor, you're reimbursed when you prescribe medication, when you you order lab work and imaging, and when you schedule surgery. In the same way, psychology is very much focused on these evidence-based treatments that are all fine and good, okay? They can reduce symptoms, but oftentimes they don't treat the underlying cause. And I would argue that making some significant lifestyle changes is a responsible first-line response to any sort of mental, emotional, psychological, or physical problem that is plaguing an individual. That these lifestyle changes should be made first and foremost and tried and really given the weight that they have, because they can be powerful forces of change for one's mental health as well as one's physical health. And as one's physical health improves, one's mental health improves, and vice versa. One's mental health improves, one's physical health is going to improve as well. So in many ways, these lifestyle interventions, lifestyle changes, and what I'm talking about here is nutrition, exercise, making sure you're getting enough sleep, stress management, getting enough sunshine, doing enough pleasurable activities, having healthy relationships. So really a very holistic look at one's health. Depending on, psychologists really mostly focus on like social relationships, healthy relationships, trying to improve communication, as well as the stress management aspects, but are really failing to guide patients in the direction of making nutritional changes. They're very quick to talk about sometimes exercise, give lip service to that, give lip service to a healthy diet, but in many circles, the idea of changing your diet, having anything to do with mental health, is laughed at, is seen as, oh, that's pseudoscience, there's no basis in science or reality, and it very much does. And I think it's really time for both the fields of psychology and Western medicine to emphasize the power of lifestyle change on a person's total well-being. So I thank you for watching and really invite you to think about and reflect on your lifestyle and how that may have a very significant role on your physical health as well as your psychological well-being. Thank you.